John, I thought this thing was supposed to be mounted on a door frame.
It's working for me.
Welcome to CareTalk, your frequent home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
And this is our guest, the Christmas tree.
Ha ha.
Ha ha ha. All right, John. Ha ha. Speaking of ha ha ho ho, President Trump, hospital pricing transparency, a big initiative for him. Is it a big deal? Is it going to help everybody out?
Oh, I think it's going to be another one of those White House initiatives that goes absolutely nowhere. I think it's it's a Republican talking point to throw prices out there and hope they work, hope they help reform healthcare. Everybody in healthcare raises their prices all the time. I don't think even if the prices were out there, it would be terribly helpful. What say you?
John, it'll probably be good for those that are, selling paper and ink, because the charge master for the hospital is thousands of pages long. What are you going to do with it when you see it? But I will tell you, one reason I might be in favor of it is the hospitals are dead set against it, which tells you there may really be something there.
And we really do need patients and families to know what things are going to cost them personally before they or during the time they're accessing any kind of care. I think that's fair, but but it's tied up with pricing everything. And to your point, it's going to get really complicated really fast. Speaking of complicated, what do you think about that Dexcom outage? It seems like that was kind of scary. And can you tell me what happened?
It was scary, John. So my understanding is that, Dexcom is a monitor that people can use if they have diabetes. They can see their own blood sugar, or for a parent of kids that have diabetes,
and it's a great technology. It's very, very popular.
It's made a big difference for somebody to be able to, especially to monitor themselves or monitor their kids. They had this outage where it just stopped working, but they didn't tell anybody that it stopped working. So someone just didn't get an alert. So they, kids slept through the night. Maybe their blood sugar went down. Maybe it didn't. It was pretty scary. And it just shows that as we rely on technology, you're in big trouble if you don't have it all of a sudden.
The FDA can help there. I mean, I think we get regulators in to help. There's so much hardware and software happening so fast. We just need to make sure that we have some guidelines and restrictions and monitoring from the FDA. I think we can fix that because it's pretty great technology. It just has to be industrial grade and make sure that you don't lose that closed loop that you think you have for early warning signs that folks are going into diabetic shock.
I mean, conceptually, I think it's simple, which is like conceptually, John, like a concept, an idea. Mr. Tree, see, he's not pushing back on me. And the idea is the fail-safe mode.
Yes.
So if it doesn't work, you know it's not working, and that's kind of the key. All right.
So, David,
yeah,
what do you think of that Medicare Advantage plan you've been eyeing as you get a little older in the years? And
I'm getting closer to it, John. A little long in the tooth.
So there's a lot of turbulence. There's a lot of noise in the system about Medicare Advantage, Medicare Disadvantage. What's good? What's bad? What do you think about your upcoming Medicare Advantage versus Medicare fee-for-service choices?
Well, I think Medicare, is a good thing. Medicare Advantage, obviously, you see more of it. It's managed care for Medicare. It has some disadvantages for people. For example, you can't just go to any willing provider. Mm-hmm. You have to be inside of a network. And if you decide to go off Medicare Advantage, you might have trouble getting Medigap coverage. But a lot of people like it. It provides a lot of extra benefits as well. You said,
So really the thing we could solve for, because Medicare Advantage plans are super popular. They're growing every year. It's 1/3 of all Medicare eligible seniors are already in managed care plans. Their satisfaction is high. Their outcomes are better. Their costs are lower. They've got more access to stuff that's free that they otherwise would have to pay for.
What could be better
under Medicare fee-for-service? But there are differences between being in Medicare fee-for-service and getting access to things like Medigap coverage. So I think we could solve it with disclosure. It's still, there's reasons why it's a pretty popular program, and it's lower costs and better outcomes.
I think
pretty interesting.
Yeah, and I think Medicare Advantage is getting better also with the new supplemental benefits. There's a lot of interesting choices.
It'll be better fit for you.
It'll be good for me, John. I know it's all about me. It's all about, it's all about David.
Speaking of you.
Yes.
What this whole PCPs becoming concierge docs, concierges becoming PCPs. What's going on there?
Well,
is
John,
it good for primary care or bad for primary
John,
care?
I know you must be a mind reader, because my primary care physician just announced that she was going to become a concierge physician, cut back her panel of patients radically, and charge Not $100, not $1,000, not $2,000, but $2,400 a year.
You must be really doing well this year.
No, I'm not going to go, John. Usually I spend $50 with primary care a year, and I'm not going to spend $2,450.
But aren't docs like yours going to make primary care unaffordable for the rest of us?
Yeah, I think it's a kind of a fringe phenomenon of people actually doing that. There's enough people around that'll pay that much, apparently. I think the problem is really that the primary care...
very rich.
Oh, John, absolutely. Absolutely, John. Not like you. But you know what? The primary care docs are like hamsters, like spinning on a wheel, and they want to get off. And I don't think concierge medicine is the way to do it. I would rather see
the PCP doctor, like to be called. I mean, what would he say?
John, when you were in high school, they used to call you the PCP man. I don't know what that was about. That's what I heard. So I don't think my brother works for the government, John, which you like. You like the government. Big government, and that's his employer. But I think that I would rather see more of a team effort in the primary care office where the doctor's doing what he or she does best, and then you've got nurse practitioners, PAs, nurses, social workers, dietitians, etc., with some good IT systems. And then I think everybody walks away a winner.
I think we have to pay primary care doctors, pediatricians, internists, family practitioners a fair wage for a critical skill. And I think that's the way to solve this concierge phenomenon in a way that allows wealthy people to make choices, that's fine, but to make sure that the average internist isn't like a hamster on a wheel and gets paid a fair amount to really take care of patients, because we're getting older and sicker with the years as a country, and we need to make sure we protect the wages and the incentives for people to actually choose primary care as they enter their medical education.
John, here's how I would put it. Primary care doctors are the lettuce pickers of the 21st century.
I think it's time for the lightning round.
John, does your 2020 vision include Medicare For All?
Oh, it's not going to happen. We've gone from Medicare For All to Medicare For All who want it, and now we're facing the fact that no one can afford it. It's not going to happen. It's a Democratic talking point. It's great that we're talking healthcare. It's too bad we're not talking about things we can afford.
Well, John, with the rise of e-commerce, maybe it should be Medicare at the mall.
So, David, your friends in the White House are proposing tightened work requirements for Medicaid and food stamps. How's that going to play out, and how's it going to affect healthcare?
Well, John, I think it's great for the Grinch in me. I can say, you know what? People shouldn't just be allowed to have food. They should have to work for it. And certainly for their healthcare, they should have to work for it. And so I think it's very pious of the Republicans to propose it. I think it'll be good for everybody. It's character building.
Every study that's ever shown on these work requirements is that it restricts access to vulnerable people who would otherwise be able to get access and qualify for it, but they can't actually get through the Republican bureaucracy that's restricting access. It's going to lead to higher healthcare costs because fewer people can eat, and that's unfair going into the holiday season. And I particularly think it's appropriate. That's called the Grinch policy.
Yeah, good. John, why are cell phones sending so many people to the emergency department?
Huh? Pardon me, what'd you say?
Yeah.
I think a lot of it's just about distraction. You think about people like you who have a hard time focusing. This could be the reason. And while you're doing that, you're probably walking and driving and other things. Cell phones are dangerous, and we're just in the early innings, so we don't even know how much of a burden they are on maybe your attention.
Well, John, it's appropriate that you talked about distraction because older people, such as some people, are actually more likely to go to the emergency room because of something related to distraction, whereas for younger people, it's more about mechanical issues with the phone. And the data weren't good enough to say what those were, but whether it was just like banging away on the keyboard, and they don't even have keyboards.
It's the weaponization
actually whacking
the cell phone.
Head whack. You're probably right.
So, David, what about your friend Seema Verma, the CMS administrator, the most important person at CMS managing the entire Medicare Medicaid budget, looking for reimbursement for her jewelry? You know,
she's gotten a lot of heat for hiring these PR agencies to buff her image, but she also filed a claim
on the jewelry.
She lost $47,000 worth of jewelry, including a $6,000 pendant designed by none other than Ivanka Trump, made of gold,
I don't even think
diamonds,
was even involved,
and something else called vermarine. I kid you not, John.
Oh, this is just another political thing where one person in Washington is probably dropping some tawdry little tidbit into the news to undermine another person. Seema's actually been the Trump administration has been trying to do a lot of innovative things in healthcare. This is just a personal vendetta, and I think you're picking on her unfairly.
Well, Alex Azar's been going after her, so I think I could do it as well. Maybe we should look under the tree to see if we can find that pendant. Well, that's it for another edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.